rotation. So to start the massage, if you're doing it from a supine, it's quite nice to have them look over towards the position so that you can free up the neckline. And I would do, to start with, a flat hand. I tend to have my free hand just on the back of the head, just to support, because my direction of pressure is always to bring the shoulder down and away from the neckline. I continue the massage stroke over the AC joint and down the arm as well. But when I get to the AC joint, you need to really lighten up, because it's just bone that you're gliding over, and it'll feel quite uncomfortable, but it can feel really nice to go into the deltoid and down into the deltoid tubercle, in and around there, where there's a little bit of tension. So your warm-up strokes, you could start with your pectoral, upper trapezius massage. And then you could do pecs, or you could come up to the neckline. It depends on, you know, what your reason for visit is. And so I will either use a cam, but a really nice soft cam, or a flat hand going down, or I create a little forefinger and thumb, and then just work my way down.
You look like you're in heaven.
Like that.
Do I?
Oh, it's been that good. I think both ways feels quite nice. So to apply pressure down towards the clavicle, and then to apply pressure back up.
I've got quite a lot of pain in my neck.
Oh, yeah.
How's
Is
it
that
feeling
painful
on
then?
that side?
Yeah, it's good. There is pain there, but it's you know, just dull.
Yeah.
Now, for you guys, there's not much technique, really. It's about feel and palpation as to how successful your neck massage is going to be. So we're looking for the mastoid process just behind the ear, and I'm going to drop just off, and I've come just to the front here because I feel like there's a little bit of tension in and around here. So sternocleidomastoid. There we go. There. So there feels quite tight, and I'm just doing some little deep effleurage, little circles, and just work my way down from that mastoid process. It's probably going to be a bit of an underwhelming demonstration, but I think the sensation that you guys will get from this. Now here I'm starting to, you can see almost the muscles split into two different directions, and this is the trick. Firstly, it's the palpation, and then it's continuing your line of treatment, line of flow, because you want to take that, there's something going on there. How does that feel for you there?
Just a bit tight.
A bit tight going on there. You can see like flicking going on now underneath my thumb. So I've got to lighten up my pressure, and I think we're going to go, that's the muscle there that I'm working, and it's probably moving into Scalene's posterior, in and around that direction. As you can see it moving underneath the skin. So I'm going to try and get my pin direction so I'm directly on top of it, and I'm going to work my way down. Lost it? That's fine when you lose it, because if the nape of the neck, there's quite a lot of distance between the muscle and the bone, so you're going to lose it at some point.
So have you got like your knuckles going over it, one either side?
This is just my thumb, really.
It's your thumb.
Just
Okay.
my thumb going down. Lighten up your pressure as you move off the neck into the shoulder, and then just come back up, come back in. Now I've come off that muscle and I'm pushing it up, but there's another flicky type muscle in and around here. So I work my way down, circles, circles, circles. Does that feel there?
At least I can feel it today.
You couldn't resist the side you had no feeling on.
Yeah.
So I'm just doing a simple kneading friction on what I think is quite tight around there. Work my way through. And that's it. It's not quite it, but I mean that's it. I mean you want to be methodical. Now that you know where those muscles are, take a line down the Scalene's anterior and the sternocleidomastoid. And then in. Scalenes go underneath the clavicle, and you can get to them from both sides. So if I was going through specifically Scalenes, starting around the SCM, I tend to support my fingers And I give each one a little bit of pressure and a little bit of a simple kneading friction on them. Jade's just done the extra bit there. Is that if you do a deep breath in, then the scalenes are activated. If you do a deep breath out, then they are stretched and you do a soft tissue release inadvertently on it. But there's no way of, you're not going to stop them breathing. So if we are going to do the scalenes, you might as well encourage a deep breath. And just be careful my nails not pinching on you.
That's fine.
But then just nice deep breath in. And then out. And work my way down through. Good. After I've done that, it's quite tense. I'm wanting to take the shoulder down. You want to encourage shoulder depression because that's going to tighten up the scalenes. You can see the scalenes come out here as I take the shoulder into depression. So next one, scalenes middle. Move across. Put one finger on the rib. One on the scalenes now. So scalenes middle. Move across a little bit. Nice deep breath in.
Either side of the clavicle there?
Yeah.
Oh, because it attaches underneath.
Attaches on the rib.
Did
yeah.
you do either side before as well?
Yeah, either side there,
cool.
either
Let's
side
do
there.
it then.
When I get to the scalenes posterior, I need to change my angle. Coming in from this direction. I have to be careful not to touch ears on these massages. I hate it when my ears get touched. Can't stand
I'm
it.
really not bothered.
Are you
Does that
not?
mean we're not going to do ears?